we're going to move to Karl Lehman. Karl is the head of Childkind and as a provider of services to families who care for children who are medically fragile and whose conditions often are very serious and likely to result in death. Do the number of deaths from medical conditions surprise you? And how do you think that families, providers, and community can help prevent these deaths? Karl is also, by the way, on the CAPTA review panel, so he has that experience. And is the microphone?
I can talk loudly. Can you hear me? All right.
Can you hear me? Sorry. Hi. Yeah, my name's Karl Lehman. I'm the CEO of Childkind. And I've been with Childkind for 19 years, and we specialize in working with families who have children with very complex healthcare issues or pervasive developmental disabilities. And I also serve on the board of Together Georgia, and I'm the co-chair of the Child Protective Services Advisory Committee, which is one of the CAPTA panels, and we've been involved, and I've been on that panel for 8 years, and we've been involved in reviewing CPS policies and procedures for a long time. So some of what I say comes from that perspective, but we started Childkind working with children in state custody who were medically fragile. And not too long ago, we started working with biological families. And along the way, we've learned a lot about providing services to this population group. And this will be a kind of a long way to get to Pat's answer, but I promise I'll be 5 minutes. And that's a difficult question to answer. But what we've determined, or what we've witnessed with parents or with families that have children with very serious medical conditions, is what I would call, there's a cloud of social determinants that surround this family. And we can categorize them, and this is especially true for moderate or low income households. And I kind of can categorize them in two areas. One, they're issues that relate specifically to a family or the specific community in which they live. And then there are issues that over the years, we've worked with about 450 families, you begin to see patterns on those social determinants that tend to affect all low-income households. And they're more systemic in nature, and we can kind of categorize them in four broad groups now. These are not complete, but one is poor housing. So low-income families with children with chronic healthcare issues. Mold, mildew, roach, rodent infestation can create a deadly environment for the children, and that's usually not caused at all by the cleanliness of the family, but by the inability, their unwillingness of a landlord to clean up their property. Second area is the difficulty in assessing life-sustaining support services for their child. Sometimes it's not the lack of services, but the complexity of Byzantine application processes that prevents families from getting the services for which they qualify. And service delivery can also be poor and inadequate. And one common example is oftentimes kids with chronic healthcare issues can miss appointments with a specialist because the Medicaid-funded transportation service didn't show up, or they showed up so late there's no way for the child to make it to the appointment. And then from the doctor's perspective, that is non-compliance and can result in a report to DFCS. Third area relates to school-based services, and this has been another common problem, particularly for the older children that we serve, that service denial, lack of follow-up when children drop out of school, and that denial of school-based services often creates a cascading effect, which in some instances can prove nearly fatal. And a very simple example, and it was the story that, or the child that actually gave rise to our home-based services program, was a child that had a traumatic brain injury. He was 16 years old, a very large child. The school system where the child lived refused to provide school-based services and because of the guardian's income, the family did not qualify for any services, and she really didn't know how to navigate the system. So the child ended up back in the hospital, very ill with seriously infected bed sores. She tried to manage the care on her own. And then the fourth area, which is probably the most complex, is social isolation. And that's a fairly universal issue. So if you're a parent, you're low income or you're moderate income, and you have a child with very complex care needs, social isolation is very common. Now, what we do know from national survey data, the National Survey of Children and Youth with Special Health Care Needs, when we look at the population that Childkind serves, we know that 60%, roughly 60% of the parents cannot maintain employment due to the overwhelming care needs of the child. So it's very easy for a family with a child with special health care needs to drift right into poverty. So what can we do? In the short term, a family has to learn to navigate the system. It is what it is, and if they want to maintain custody of their child and for the child to get well, what Childkind does is we teach them how to navigate the system, and then each family must be supported in their home environment. So services, what we do is we focus the services in the home, spend as little time in the office and as much time in the home environment. But I think in the long-term goal, for the provider community, for the legislature, for the government offices, but my hope is that Georgia will recognize the impact of the common adverse social determinants and take well-researched and thoughtful steps to mitigate them. And what that means is taking the time to review all of the types of services that a family needs to access and begin to develop methods to reduce the complexity of access. And that would go a long way to protecting children and reducing the number of medically fragile children who die.